wanted to talk to you briefly about tarsal tunnel injections and what they are. There's always a subset of people who come in and say that when I'm standing for too long, I get a pain and a burning and a tingling in the butt of my feet, and I can't stand it. It's often people who are either gained a lot of weight or wear big, heavy equipment boots, who are on concrete floors all day like a foreman manager at a plant. And you're probably dealing with a thing called tarsal tunnel syndrome, which is a little bit like, not exactly like, but close to carpal tunnel syndrome in your hand. Tarsal tunnel syndrome is where the nerve on the inside of your ankle, called the tibial nerve, sends two branches. And the two branches are these two branches called the medial and lateral plantar nerves, and they basically supply most of the sensation in the bottom of your foot, everything from the heel up. So if you pinch that nerve, like you pinch any nerve, it's not going to like it. You're going to get a pins and needles sensation and sometimes a burning sensation. Often patients who have tarsal tunnel will have flat feet. Their feet will kind of bow out, and that tends to get worse as we get older because the arch in our foot tends to flatten out and it tends to press in that area a little bit more. So how do you determine it? Well, clinically is one. There's a clinical exam you can do. You can do it by electrodiagnostic or nerve conduction studies where in some people, most of the nerves look pretty good, but you test the nerves in the bottom of the feet and they're shot. They either don't show up or they look really delayed. In terms of treatment, there's a couple things you can do. One is go to a podiatrist. We can set you up with a podiatrist who can give you a good pair of inserts in your shoes, give you comfortable shoes, and basically even out your arch so your foot goes from this to straight and takes the pressure off of them. If that's not working, we can try a tarsal tunnel injection where we grab the ultrasound machine, we put a needle near the nerve but not on it and squirt it with a little anti-inflammatory medication to just quiet the nerve down, and we can always repeat that injection if necessary. There is a surgical option, of course, but most podiatrists don't like to do that if they can help it. And the last option, if nothing else is working, we can try some regenerative medicine in the bottom of the foot, which can not only quiet the nerve down but help rebuild the arch of your foot. So if your arch is starting to flatten out and you inject along what's called the spring ligament on the inside of your ankle, on the inside of your foot, it'll start to give that arch back again. And typically when the arch comes back and you inject around the nerve, you fix the arch and you heal the nerve and people settle down. So there's a couple options. If you have tarsal tunnel and you're thinking of going under the knife, talk to us first and see if we can help you.